Good afternoon. My name is Doreen, and this is my colleague Christina. And as introduced, we are from Ubongo Learning. So Ubongo is an African-bred, non-profit organization that creates edutainment for the African child. We started off in 2013 as a group of 6 and have now grown to a group of 31 in 4 countries. What is our niche? We create localized, educational, but yet entertaining content. And our co-founders come from different walks of life, but yet they shared the same passion, which was helping the African child find the fun in learning. And why was this important? It's important because most of our children here learn in overcrowded classrooms with little to no resources, and they're taught to adopt a rigid cramming style of learning. And what this does is it automatically and quickly creates a dislike for learning, and this contributes to school dropouts as well as poor academic performance. And so this is where Ubongo saw an opportunity in a challenge. So how do we go about solving this challenge? Well, at Ubongo, we do not only do it for the kids, we do it with the kids. So what we do first is we are informed by localized educational research, and this is where we involve children. So from identifying the knowledge gap, to story brainstorming, to reviewing, all the way to engagement evaluation, we involve children in each and every step. And something that we've learned through this process is that in order to create content for children, you have to think as a child and be a child yourself and not an expert. So once we have identified a learning objective, we then use the power of entertainment where we speak the universal language of fun, because who doesn't like fun? And this is where we turn it into catchy songs and fun storylines. From there, we distribute it through mass media, where television is our biggest platform, but we've also seen an increase in radio, YouTube, mobile application, as well as print book and ebooks. Our products include our show called Atli and Me, and this is a show for preschoolers which teaches numeracy, literacy, social-emotional learning, as well as health and nutrition. We also create content for parents and caregivers, which is our show called Tunakujenga, and this is meant to equip parents and caregivers with the knowledge and tools to be able to support their children in their development. We also have Atli and You toolkits, which then breaks down all our content into specific tailored chunks as required or requested by our partners. And then our flagship show, which is Ubongo Kids. This is a show targeted to kids aged of primary age, so that's 6 to 13, and we teach STEM as well as social-emotional learning. And then recently we've also included Ubuntu, or as we call it, Utu in Kiswahili, because we feel like it's really important to create the value of shared humanity in the next generation. Have we been successful in what we've been doing? The answer is yes. Our Atli and Me audience has proven and has shown significant increase in not only numeracy but also literacy. And at the same time, our Ubongo Kids audience has also shown a significant increase in those topics that we teach them, not only in their knowledge, but also in their attitude as well as behavior. And now I'm tired of hearing my own voice, so I'll hand it over to Christina.
Thank you. So we broadcast in 31 countries across Africa. So we broadcast currently in Kiswahili, in English, and in French. And we understand that kids learn best in their local language, the language they feel most comfortable in. So we are in the process of adapting our content into 5 new languages. And hopefully we'll get there where we include every language in Africa. This figure here, 15.5 million, is the number of households we reach. And this is just for the countries that we have access to data in, which is the Eastern African countries. We estimate that we're matching that number in Western Africa and Southern Africa. And we're estimating at least 2 children per household. So slowly we're getting there, reaching 500 million kids across Africa. Let me put on my Ubongoers hat for a moment. Thank you, Nicole. Who are Ubongoers? Ubongoers, we love to fail. We know that failing puts a fear in people, but we love to fail because we know that failing gets us one step closer to where we want to go. We also love learning. Not only are we teachers through our content, but we also learn. We're not just learning in terms of what our job role requires, but we're learning in terms of what we need to progress the knowledge that we have and our own kind of progression into where we want to become. So if there's things like events, like conferences, we don't just send people who have the right job titles, but we send people who can learn the most from those events. Our business model is also always learning. It's not a one-size-fits-all. We came from being a for-profit, focusing on B2B and B2C, and we've evolved into a non-profit. So we still focus on B2B, B2C, we still sell merchandise, we still have revenue streams coming in, but we also do grant funding, philanthropic funding, and digital marketing. Digital marketing because we know the future seems to be in the digital platform, so we're really investing in that. How does that look like? Our YouTube is picking up a lot of revenue, especially from the diaspora African communities. And we also have our social impact apps. And if I dare say, we're borrowing the Robin Hood type model where we are making our Android apps free because we understand that that's the majority of our African users. And we're charging our iOS apps because that's the majority. I know, have to do what you gotta do. That's the majority of our diaspora audience. So with that being said, we love this conference because we understand that we have to work together for the sake of the children, and we are always building on what we know works. So we're taking that forward, but at the same time, we're always challenging our perspective and understanding that there's room for learning, there's room for growth, and there's room for doing things differently. And I think I'm under 5 minutes, but I'm going to get off stage because my shoes are killing me.
We'd like to join Nicole's friend as well and say, Doreen and Tina, we are fangirls as well. Just before we start, well done. Sparking big ideas and creating new connections are part of what makes events like this really great. 2 years ago at the First Think Future, Meg and I were lucky to reconnect when Earlybird was just such an idea.
And we'll be forever thankful to Think Future for bringing us together again. Although, by way of a spoiler alert, we have not, between Think Future 1 and 2, built a social enterprise from blueprint all the way to scale. We have learned a great deal, though, in embarking on this journey to develop a social enterprise that has the capacity to deliver impact sustainably at scale.
Today, however, we'll be focusing on just 2 insights in particular, on some of the non-obvious ways we found where we've needed to innovate.
So, we have a graph. Yes, this is quite a funny graph because we are living inside this graph, and it is very chaotic. There's R&D, and there's demonstration, and then there's more R&D, and then there's some deployment, and more R&D. But I have been told that from those seats out there, it does look like a nice smooth curve, so let's go with that. I think it's a reasonable simplifying assumption for a 5-minute talk that there are sort of fairly distinct phases in the development of a social enterprise. And so we marched happily into our R&D phase. We knew that we needed a really high-quality Educare model to meet the exacting standards of corporate parents who are really battling to balance the demands and responsibilities of childcare and their children, and the demands and responsibilities of their careers. And so we needed to think about this. We didn't want to reinvent the wheel. We knew that there are a lot of curricula out there that have been tested and so on. But careful readers of the existing body of evidence on ECD globally will know that curriculum has not been shown to be a core driver of quality, unfortunately, because there are a lot of off-the-shelf curricula that we could have used. But really, some of the more core drivers, and one of the big ones of quality that research has shown us, is quality interactions between teachers and children. This is a remarkably subtle and difficult skill to inculcate in teachers. What we also do know from the research is that in-service mentorship and in-service training is a much more effective way to improve teachers' ability to have quality interactions with kids, much more so than pre-service training. Bit of a bummer here, though. In-service training and mentorship, very expensive. So we had to innovate, R&D. We worked with the Reach Trust and the excellent Launchpad platform funded by the Innovation Edge to develop a digital daily activity guide for our teachers. It's tablet-based, and all of the activities on that guide have been tested in South African preschools, and they're super high quality, hands-on, full of fun, interesting activities. There are photos of the activities, and attached to the photos are audio prompts, which give the teachers just-in-time pedagogical prompts that help them to ask the kinds of open-ended questions that really catalyze those kinds of quality back-and-forth interactions. They also give teachers suggestions on how to scaffold learning and development and how to extend learning and development. Again, some subtle skills that a lot of teachers battle with. So we worked on that, and that's just one example, we worked on a lot of other tools and systems to develop a cohesive Educare model. And we're finally feeling like we're there at the point where we've designed a cohesive model that can scale. And that's great. So that's one piece, the product R&D. But we also had to do a lot of R&D around our delivery mechanisms because we wanted, Robin Hood vibes, to figure out a way to both generate revenue and create impact using a similar or highly overlapping set of inputs. And to achieve this heavy lift, go figure, dun dun dun, a big part of it is partnerships. Not just any partnerships with property developers, specifically commercial property developers and social housing property developers. So we work with our developer partners to set up Educare centers in commercial areas where there are lots of businesses and working parents who need access to quality Educare. And we also work to set up Educare centers in social housing developments where there is a real shortage of access to high quality, affordable Educare.
Back to our graph. So with our product and our delivery mechanisms in hand, we set forth and spent a considerable amount of time building a healthy pipeline of new centers that we could open. Some of these centers have been signed off, and others are still in the ready to sign off phase while we try and source the funding we need to make them happen. We're in what's precariously and known as, I guess, globally as the valley of death, somewhere between demonstration and deployment, where you're trying to bring your dream alive. What we've noticed is that just as we've needed to innovate around our product design and around our delivery mechanisms, we're having to think quite creatively around, one, the funder we pursue, and two, the type of funding we go after as we're trying to reach our goal for scale and reach sustainability. This journey has been quite creative. It's made us really consider a number of things. We've had to pick grant funding against equity funding. We've had to delve down the rabbit hole of creative financial instruments that could possibly tailor in the needs of both us and our investor. We've had to think about whether one investor or multiple investors is the route to go. And what we've really realized is that the solution lies in obtaining flexible funding, financial funding, from a social partner who's really engaged in Earlybird, who really understands us and is aligned to our mission. So in summary, what we're trying to say is a great idea is a great place to start. But really, the innovation comes through the processes and mechanisms that take that idea and turn it into reality. Thank you.
And now I get to indulge in my secret fantasy, maybe not so secret, of being Oprah. I don't know what Oprah does, I think she does this. Anyway, please join me in welcoming my first studio guest, Simon from Merrick Mobile. Simon, thank you so much for joining me in the studio today, and I'd like to thank our live studio audience.
Thank you for having me.
Simon, in just a few words, please tell us about Merrick Mobile.
Merrick Mobile is a non-profit company, technology company, and we build software targeting frontline health workers. Think of a community health worker who goes door to door delivering care. That is a person that we target with our technology.
Now tell us about some ways that Merrick Mobile makes the lives of community health workers easier.
Great. So as I mentioned, our core niche is a community health and working with community health workers. So we equip them with our mobile tools, which they use as they're delivering doorstep care. So our technology supports them in determining who and when care is needed, guiding them through the process of delivering care as they do household visits, as well as providing them with metrics around their own performance so that they can be able to track their own individual performance against set goals or targets. Additionally, the tools also produce data, obviously, and that data is used by their supervisors to be able to provide coaching and mentorship for those community health workers.
Fantastic. Now, I know from looking at your website that you've got lots of success stories. Maybe just share a few with us and our live studio audience.
Yes, we have a lot of success stories to share, but I'll share just a few. So Merrick Mobile started in 2009, and when we were starting, we were using third-party open source tools. Over the years, we've been working with our partners to co-design and build our own software. So presently, we have SMS and mobile applications that work on Android. And we've been able to scale that with a number of partners across the country, in Kenya, and in many other countries across Africa. So also what is important to note is that we are increasingly influencing a mind shift from a perception of frontline health workers, such as community health workers, being positioned as data collectors, to them being positioned more as people who coordinate care at the household level. Also, important to mention is how our approach is to technology. So we do a lot of human-centered design. First of all, understanding what the context is, who the user is, what are their pain points, what do they do, who do they do it with, how do they do it, so that we can be able to build a software that's a companion and complementary to what this frontline health worker does on a day-to-day.
Now, I'm sure developing this product wasn't easy. And my brilliant scriptwriter, Mitch Miller, has given me this question to ask you. So you are operating, I understand, in more than 23 countries in Africa and Asia. So tell us about some of the challenges and lessons you've learned along your journey.
Sure. So we are working with great partners. And these partners have been able to create some of the fastest health systems in the world. And just to give you an example, one partner in Mali called Muso is working with a network of community health workers who've been able to reach significant numbers of mothers and children under 5 to deliver life-saving interventions. Well, we've been able to scale to more than 23 countries, reaching about 26,000 users with our tools. And these users deliver, on a monthly basis, about 1 million household visits. That is significant. And we've realized that at scale may not be the challenge. The challenge really is, how do you scale, for whom and where it matters the most? How could we position our technology in a way that it could be replicable across contexts and geographies? One good example to give here is how we've been able to build our software with offline fast functionality, that these frontline health workers can be able to collect data. They can be able to coordinate care on a daily basis, offline, and be able to synchronize that data later on. So this is a good example of what is technically challenging, but absolutely critical. As we scale, I'll give you 2 examples, actually 3, of our network of users in Togo, in Mali, and in Kenya. So on a day-to-day, these people go to the households to deliver care. Think about maternal and child health. Think about nurturing care. And we have been able to test, for example, whether we could be able to use our technology to deliver nurturing care. It was an imagination of how could we really be able to position this technology to solve for that challenge. Fortunately, we met partners who are eager to experiment and invest in this with us. And these are SAFE, PATH, African Early Childhood Network in Kenya, as well as the government of Kenya. And our question was, could we be able to reach every family and every child with nurturing care? Again, we had a core asset in the community health workers who were eager to integrate nurturing care on what they do on a day-to-day basis as they visit their households. Our ask or our delivery within that context was to deploy a technology that could support them in identifying suspected delayed milestones, children with suspected delayed milestones, and be able to refer those people to the health facilities. What was interesting about this is that we were able to identify 6 times more through this proactive approach, children who are suspected with delayed developmental milestones than what traditional status quo systems were able to. So this is a good indication of scale in terms of numbers and scale in terms of what the technology could do, pushing it to the limits.
So those are some big numbers. You were saying 26,000 users, 1 million household visits. What's the vision for the future?
That's a good question. The future is indeed bright. The future is indeed challenging. What we've realized is that health is bigger than any one of us, than any single organization. And I think that's the reason why we're here, trying to find opportunities for collaboration. What Merrick Mobile is doing right now and is challenging its partners to do is to make available technology for public scrutiny and examination. We've decided over the last year to make our tools truly open source through what we call the Community Health Toolkit. And the Community Health Toolkit is really a project for many partners, including Merrick Mobile and others who are implementing within the community health space and have a critical desire or passion on the use of technology. And the core driver here is technology is becoming increasingly a core part of health service delivery. And so, more importantly, should it become more open and more subject to scrutiny and more open to ways that it could be expanded by many other people, not just the owners or the developers themselves.
Simon, thank you so much. We wish you all of the best.
Thank you so much.
Next up, I'd like to invite Lucky to join me.
Hi, how are you?
Good, how are you?
I'm okay.
What on earth is that on your hand?
Oh, it's a machine learning.
A what?
Yes,
A machine learning.
exactly.
Okay, I think the best way to do this is you're going to have to give us a demonstration.
Okay, it's a glove sensor. It translates sign language into voice. Basically, what happened is that if you have a mobile application, it's also going to detect your voice and play into South African Sign Language animation. You can also make phone calls. A deaf person can also listen to the radio by just putting a mobile phone next to the radio. It detects your voice, play animation of South African Sign Language.
That's
This is what it
incredible.
goes.
You're going to show us?
Yes, give me a
Okay.
second.
The Bluetooth device is ready to pair. Line in. Below. Below. Below.
Oh, no?
Below.
Hello?
How are you?
I'm fine. How are you?
How are you?
I'm good.
What is your name?
I'm Nicole.
What is your name?
I'm Nicole Biondi.
Okay, basically what happened is that in this glove, we have few words. The reason why we have few words, this glove was invented and then it was also like funded by my personal, finances. Then we still on the phase 1 of the development. Basically what happened is that the glove sensor, it's helping deaf people to communicate with hearing people. It's either in the baking environment, in an education environment, you can mention everything that you can know that this glove sensor can work. Again, it also helps deaf people to make phone calls. What happened is that if you're a hearing person, if you call a deaf person will look at the animation. Then if a deaf person wants to respond back to you, he or she will sign, you will hear a voice that other side. And again, it's that it gives them an access to listen to the radio station. There's a challenge that deaf people, they're not getting exposed to the media, explosion in terms of the radios. They are more excluded. But through our system, we give them an access.
Lucky, that's incredible. Now, what made you come up with this idea?
It's a very shocking story. I was raised by deaf parents. All my parents are deaf. They can't able to talk. They can't, it was very hard for me growing up, I used to be mocked at school about the situation of being raised by deaf parents, your parents can't able to talk, those kind of a thing. That's where the glove sensor came in. Because if I want to ask money to my dad, I had to speak to my mom, said, you know what, can you ask for something to my dad? I need money to go to school, those kind of a thing. But it was very bad to me because when I was growing up, I had this kind of anger, saying that I need to come up with something that will make me to communicate with my parents because it's really bad.
I can imagine. It must have been frustrating.
Yeah.
And how do your parents feel about it? What do they think?
Okay, on Saturday, I went with BBC in Limpopo. Basically, I've just shot my documentary with BBC on Saturday. When they saw people coming with cameras, they were very shocked. They said, what's happening? Where are these people coming from? I was like, no, I want you to be on TV, guys. They were very excited, They were also indicating an issue that there are a lot of deaf people who have dropouts from universities and also in our school, but they're not employed. The reason why most of the employers, they said, if they are employing deaf people, there has to be an interpreter on their behalf, meaning that they're making more extra costs for the employers, because the employer has to employ a deaf person and also an interpreter. They were like, using your system, it will help us a lot. We will also open a center where we'll be having a call center of linking banks, insurance. There's this kind of a scenario you find that maybe a bank can just call and say, hi, Lucky, you qualify for this kind of a thing. But to deaf people, they don't have that kind of opportunity. Again, we're trying to get rid of this thing where, you remember in the funeral of Nelson Mandela, there was a guy who lied about South African Sign Language. Then we don't want those things. Then we're trying to get rid of those kind of a thing. Yeah.
Those are a lot of problems you're solving.
And then we're trying to solve those kind of a thing. And then what happened is that globally, with the state that was indicated by World Health Organization, we're sitting at 466 million of deaf people in the world. And 432, it's for the adult, and 34, it belongs to the children. And it's indicated that in 2050, 900 million people will be deaf. And then 12 to 34 young people, they're at the risk of losing their hearing loss.
Wow.
And then, is it 1.1 billion, by the way? Yeah, they're in a situation of, they might in a risk of losing their hearing loss. Because of sound, because of wrong medication. My mom, she was once encountered in a situation where she received wrong medication because of poor communication at the hospital. We really need system in place to cater for the persons with disability. Even in a learning environment, deaf people, they are more, excluded in a learning environment. Lecturers or even educators, they can't get involved because they don't understand sign language, because there are no system in place that are helping them to communicate. My mom, she started having a bank account on 2017. Why she had it this later, on the later stage? Because she didn't have someone to assist her on the interpretation, because meaning that with deaf people, everything that you need to do, there has to be a third party, or there has to be a second party on your situation. Like, let's say an extent, if you're consulting about your health, someone must interpret about it. No, it must come to an end. South African law says that we have the right of information, we have the right of privacy. Where is that applied to the deaf community?
Absolutely. Lucky, we were chatting earlier, and you were saying that you've just come back from Dubai and something.
Oh yes, I was in Dubai. Oh yes.
Just by the way, he was in Dubai like last week.
Yes.
Oh yes.
I was in Dubai. Finally, when I was in Dubai, I was showcasing my invention. The government in Dubai, in the Department of Tourism, they said I should develop them a system that translates Arabic into English. They were very interested also to see my invention. Basically, they said to me, they only need a fully functioning product. That way they will buy in. But now I already have a project to develop a software that translates Arabic to English. In UAE, I'll be counting in dirhams, not in rands.
So now, where are you at in development at the moment, and what do you need?
Basically, we are on the phase 1 of the prototype stage. We still are raising funds. What we're looking for now is for collaboration, partnership, or sponsorship per individuals. Because, I'll have to outline this. We have been applying for the government funds. They have their own processes and everything. We have clients out there. There's an organization called MDDA. It's one of the radio organizations. They manage all the radio stations in South Africa. They were like, as soon as this product is out for the market, bring this to us because we want to hire deaf people. We also want deaf people to have access in the media platforms. Even in the higher, if you can go through our website, we have partnered with City of Tshwane. City of Tshwane, they want to implement this system on the municipality because deaf people, they struggle a lot when they're alleging or complain about water, electricity, Every time there has to be someone interpreting on their behalf, those kind of a thing. Even in the universities, lecturers that are complaining because interpreters are using wrong words. You find that maybe a lecturer is using a bombastic word. You as a lecturer, you interpreting wrong information to the student. Then we don't want those things. Then let them be independent, have their own system to be able to communicate. And those interpreters that are being paid a lot of money. But through the system, we can save a lot of money for the government by just having the system in place. Thank you.
So, we don't know. We might have a wealthy benefactor or two in our studio audience with us this evening.
Okay.
Talk to us about the money. What's it going to take?
Okay. For phase one of the product, and the good thing about this product, it's patented nationally and international. There's no, we won't steal, trust me. It's patented. We're looking for 1.2 million just to finalize the development. It's only going to take us 6 months just to wrap up and to commercialize everything. Dollars or rands? In dollars, my man, you're right. Because I can't talk about rents because we also have people from America and yeah.
$1.2 million.
Yes.
6 months.
Done. We distribute to the university, hospitals. We are avoiding people to get wrong medication. Think Fisher was supposed to have deaf people. Those people are very active. They are very active, but now they are more excluded because they know that if they come here, what kind of a source of communication need to be implemented for them? None. Yeah, I think in the next 2 years, Think Future must have glove sensor.
Absolutely. 2021. Lucky, I have no doubt that you're going to make an incredible success. Your passion is heartwarming. It's inspiring.
Thank you so much.
We wish you all the best.
Thank you so much.
Thank you.